In late March 2019, when Bahrain was preparing for Grand Prix, dozens of political prisoners were writhing in pain behind bars. These high-profile prisoners were denied adequate medical care as a form of punishment by the Bahraini regime. The prisoners are mostly serving time for their peaceful pro-democracy protests in the year 2011 onward. According to Joe Stork, Deputy Middle East Director at Human Rights Watch, many of these people should not have been imprisoned in the first place. An arbitrary denial of medical care may amount to extrajudicial punishment. Bahrain's authorities have reportedly denied them urgent medical care, access to specialists, medication, and medical examination.
These prisoners are serving terms because of their work. Thus, Bahrain is trying to punish them, to teach its people, like, if you're gonna dare do something against our rules, we're gonna put you in prison and we're gonna punish you, we're gonna take revenge of you, we're gonna strip you of your rights, and you have nothing to do with us.
Fact check 1. How many political prisoners are there in Bahraini prisons? A. About 1,000. B. About 2,000. C. About 3,000. D. About 4,000. Among the prisoners is Abdul Jalil Al-Singais, an academic now serving a life sentence. He had been arrested and released in 2009 and 2010 for his human rights activities before he was arrested again during the widespread protests of 2011. A man in his late 50s, Al-Singais' health has worsened in prison. His family say that he is suffering from acute chest pain and numbness in his fingers resulted from torture. They say Bahraini authorities did not allow the prison doctor to examine him from 2017 to mid-2018, and when the doctor said Al-Singais needed a heart specialist, they wanted to take him out in shackles, a condition Al-Singais regarded as beneath his dignity. In its September report, Amnesty International wrote that the denial of medical care for seriously ill imprisoned activists latest act of cruelty.
Mr. Abdul Jalil Al-Singais, these are like Sheikh Ali Salman, these are the leaders who were guiding the people in their peaceful movement to demand their rights and freedoms, to demand more political participation, to demand more political and civil rights for the people of Bahrain, and to demand like a fair distribution of the wealth among all the people. These people are serving terms because the Bahraini authorities are cracking down anyone who tries to criticize its policies, who tries to highlight the violations that are committed in the country.
Just like Abdul Jalil Al-Singais, Hassan Mushaima is serving a life sentence for his 2011 peaceful protests. The head of Al-Haq opposition party has lymphoma, a type of cancer that begins in infection-fighting cells of the immune system. While he needs screening tests every 6 months, Mushaima has not had the test since August 2018. In his early 70s, Mushaima is also suffering from chronic disease like diabetes, high blood pressure, and gout. Prison officials say they would transfer Mushaima to hospital only in shackles. That's while the Mandela rules ban the use of restraints like chains and handcuffs on older sick prisoners who do not pose an escape risk. The septuagenarian politician has so far refused to accept the humiliating condition.
Mandela rules are a group of rules that highlight the minimum standards of how the government should treat the prisoners. They try to preserve their medical rights, their dignity, their privacy, not to be tortured, and all this stuff. Bahrain is violating most of these rules because all of the political prisoners and the prisoners of conscience are tortured to confess some things that they haven't committed. They are ill-treated. They are stripped of their rights, denied medical care, sometimes denied clean water, drinking water.
The Bahraini regime treatment of younger prisoners is no better. Naji Fatil, 45, Ali Haji, 36, are among other high-profile prisoners in Bahrain deprived of medical care. Fatil is suffering from spinal and other injuries resulting from torture in detention. His friend Haji, on the other hand, has been denied of a necessary surgery on his lower jaw. Fact check 2. How many political prisoners are reportedly being tortured in Bahraini prisons? A. 30+%. B. 40+%. C. 50+%. D. 60+%. In an egregious case, Bahraini prison authorities have denied medical care to Elias Al-Mullah, a 28-year-old man with stage 3 colon cancer. In last August, he was allowed to have the required medical test, but the authorities have so far refused to give him the test results. According to his mother, Elias was transferred to hospital for chemotherapy sessions in shackles that caused him severe pain and bleeding.
We are really concerned about their health conditions, physical health conditions and mental health conditions. They are put under so much pressure that they should not undergo. They are not criminals to be put in jail. They are high-profile people who were trying to make Bahrain a better place for all the Bahrainis. They should be respected. They should not be put in jail as if they committed something wrong or a crime.
As Bahrain is closed to independent outside observers, it is not easy, if possible at all, to know what exactly is happening to the freedom-seeking activists in its high-security prisons. In mid-August last year, more than 600 prisoners in Joe Prison and Dry Dock Detention Center went on a hunger strike in protest at prison conditions, including denial of medical care.
The only update available from the prisoners is that their health conditions are really deteriorating. They are banned from regular checkups to see how their conditions are developing. They are banned from their medications. They are banned from regular visits to doctors or hospitals or healthcare centers. Some of these prisoners are diagnosed with serious conditions like cancer, or some of them are with chronic diseases like high blood pressure, high cholesterol, and all these stuff that...
Fact check 3. Prisoners in notorious Joe Prison are reportedly suffering from A. Humiliating and degrading treatment. B. Deprivation of sleep and denial of food. C. Beatings and forced disappearances. D. All the above. According to the Bahrain Center for Human Rights, BCHR, many detainees in Joe Prison suffer from diabetes due to the denial of the necessary treatment. In November 2018, 52 members of the European Parliament condemned the mistreatment of political prisoners in Bahrain. The latter highlighted that the pattern of denial of medical care and religious discrimination is common across Bahraini prisons. The letter also noted abuses in Isa Town Women's Detention Center, where political prisoners like Hajar Mansour and Medina Ali appear to be deliberately targeted by punitive restrictions, ranging from medical negligence and religious discrimination to physical assault.
The thing is that the prison conditions are very bad, not only for these high-profile prisoners. They are also bad for all the political prisoners. There are news that many diseases are spread among the prisoners because of the lack of hygiene, lack of medications, lack of adequate medical care, and regular checkups.
Bahrain's human rights outlook seems bleak, and no doubt without independent oversight bodies, political prisoners will continue to fall prey to an unjust and inhumane jail system.
وعينا على جزيرة العرب